guide her.
F5, if you can see the F5 button at the top.
Yeah, yes.
F5 button एक बार press. Share screen के बाद, after share screen, you can press the F5 button. F5 button now.
Okay. No. No.
It's not working. Madam, click on that slide and then tap F5. Maybe that will work. एक बार.
Abhi? No.
No.
I guess we can continue like this.
अच्छा मैम,
Yeah, we can continue. You
आपका
can.
माउस पॉइंटर आप एकदम बॉटम ऑफ द स्क्रीन पे 94% लिखा है ना, उसके जरा से लेफ्ट पे एक स्लाइड शो वाला आइकन है, आप उस पे प्रेस करोगे तो स्लाइड शो स्टार्ट हो जाएगा एकदम नीचे नीचे.
अभी तो कुछ भी नहीं दिख रहा है.
She is full screen. She is seeing full screen, but it is not coming full screen here. So, madam, I think you continue as you are listening.
Anything is visible or nothing is visible?
No,
now
you're
the
not
sharing is stopped.
What I should do now?
You do one thing. Just open the PowerPoint through share screen.
PowerPoint is there.
Yeah, no. You go to Zoom and share the screen.
Zoom में तो क्या?
Yeah, now it's fine.
दिख रहा है?
Yes, madam. Now it is fine.
Yeah,
now it is
now
fine.
It's fine.
Yes, yes.
Just go forward. Yeah, that's fine.
Okay.
Now you can start.
Thank you. Sorry for this disturbance, but I am not visible for myself, so I don't know.
Yeah, that's fine. That's
okay. So
slides are visible.
No financial interest. So why these ideal operation theaters are important? Because surgical care is an integral part of eye care system, and ophthalmitis is the most devastating complication of any ocular surgery. Surgical site infections are the second most common cause of hospital-acquired infection. So every step should be taken to reduce the devastating complication of surgery. If we look at the evolution of the operation theater, so operation theaters has evolved from a simple room with a minor equipments to a packed theater, and eventually to the sterile and special environment of the modern operating theaters from 18th century to 19th century. This is a consequence of acceptance of germ theory of disease that was theorized in mid-16th century and validated in 19th century. So if we look at the historical perspective of surgery of eye, so it was started from the house as a couching, then camps in a school, dharmshala, community halls, hospital in a primary and community health centers. Other venues are in train, van, ship, and plane. So now, what is ideal operation theater? An ideal operation theater is an environment in which all sources of pollution and micro-environmental alterations are kept strictly under control. Fundamental principles: no harm to the patient and surgeon. A standard operation theater protocol should be maintained, and operation theater should be customized according to the size of hospital, patient's turnover, available resources, and future need. So what includes this ideal operation theaters? Location, design, environment, equipment, instruments, central sterile supply department, other supplies, traffic in operation theater, dress code, maintenance, OR surveillance, OR biohazardous waste disposable, safety measures, handling of emergency, and proper ongoing training of the staff. So location, it should be a low-rise building. OT should be separated from the general traffic and air movements of the rest of the hospital. Space of OT should be accommodated the needed equipments of the staff. It should be minimum of 450 square feet, while if we want to accommodate more general anesthesia and other equipments, so it should be 576 square feet. The door should be adequate with width of 1.2 to 1.5 meter, sliding, and a small window should be on the door. Surface should be slip resistant with minimum joint, seamless wall, and washable paint. Pendant for the pipelines, services like oxygen, nitrous oxide, medical vacuum, compressed air, and electric sockets. So this is a pendant. Lighting ceiling mounted lamps with illumination of 500 lux with minimal glare. UPS of adequate capacity for OT light, microscope, machines, monitors, anesthesia machine until generator backup takes over. Audiovisual system is also important in operation theater for recording as well as for the demonstration and teaching. Scrub sink should be for 2 to 3%. Water should be filtered. Water tap should be hand, foot or sensor operated. Water tap should be of 10 centimeter above the wash basin. And adequate continuous water supply should be available in operation theater. Environment of operation theater is very important, which is controlled by the ventilation and temperature. During surgical procedures, dust particles, textiles, fibers, skin scales, and respiratory areoles are loaded with the viable microorganisms are released from the surgical team in operation theater. Risk of infection is significant if aerobic bacterial count is in the range of 700 to 1800 bacteria carrying particles. But if it is insignificant when count is 180 per cubic meter. High quality air is essential to control the risk of surgical infection. So direction of airflow should be from operation theaters towards main entrance. Efficient ventilation controls temperature and humidity in operation theater. And as Dr. Mihir has mentioned, the separate air handling unit should be in each theater to prevent any cross infections. Airflow should be unidirectional. HEPA filters have a 99.7% efficiency in removing the airborne particles of 0.3 micron and above by ceiling mounted laminar airflow. So positive pressure system should be in operation theater. There should be 5 centimeter H2O from ceiling of OT to downwards and outwards to push out air from OT. Relative humidity should be 40 to 60% to be maintained, and temperature should be between 20 to 24 degrees centigrade. In one operation theater, one table of 1.8 meter long, instrument trolley of 0.9 meter long, while working space around the table should be 1.2 meter. And in per operation theater, per operation table, there should be 3 complete cataract surgical instruments should be available. Unwanted equipment and instruments should not be kept in operation theater. In pre-op area, where the waiting and recovery, the monitor should be available. Oxygen gas suction pipe should be connected with the central facility, but standby local facility should also be available. Patient's stretcher, trolley, vehicle, wheelchair should also be available. In central stage department, the instrument, equipment, and material should are sterilized. At the end of the operation, the buzzer system from operation theater to CSSD staff for information that hatch window is ready for the cleaning. So this is hatch window. Used instrument should be returned to the CSSD for the cleaning through this hatch window, and the dirty corridor should be patrolled by the staff. And after sterilization, the reissue of the instrument should be from the another window. There should be controlled traffic. And the other facility should be available for the communication, data management, satellite stores, safety measures, restroom, changing room, lockers for the staff. Maintenance again is very, very important for the operation theater. Comprehensive maintenance and annual maintenance contract should be available for the everything. And spare planning should also be there. Maintenance of air conditioning filter system also important. Dress code is also important for the patient as well as for staff, especially in this COVID era. Everyone has to take care of all the dress code. Proper ongoing training is also again important, because in the medical science, every day new technologies, new equipments are available. So the staff and the doctor should be trained with all these new systems. So in conclusion, the ideal operation theater can provide maximum benefit to maximum number of patients, save surgeons from stress, prevent devastating complications like endophthalmitis, and improve cost effectiveness of the hospital. These are my references. Thank you. Thank you.